Because radiation is detectable, radioisotopes are useful for imaging purposes. Some elements are useful because they concentrate in certain tissues. When isotopes are chosen for imaging purposes, they must have a short half-life to minimize exposure to radiation. Isotopes that are used for imaging purposes are also known as tracers. As an example, iodine concentrates in the thyroid, so iodine 123, with an effective half-life of 12 hours, is useful for diagnosis of thyroid functionality. This isotope is a gamma emitter, so its radiation will travel over a long range. These images of a thyroid obtained through the use of an iodine 123 tracer are shown on the slide. On the left, the isotope is evenly distributed throughout the thyroid, indicating a healthy thyroid. On the right, a cold spot is seen, which shows up as a dark spot, indicating a region where the thyroid is not functioning properly. A section with a high concentration of the radioisotope, or a hot spot, would imply cancer. Radioisotopes are also used to destroy cancerous tissue. Isotopes used for this purpose will have longer half-life than tracers, and also lower energy radiation emitters, such as beta particles, is favored if the isotope is to be placed in the body. Consider the difference between iodine 123 and iodine 131. Iodine 123 has a shorter half-life and is a gamma emitter, which is preferred for imaging purposes. Iodine 131 has a longer half-life at 7.6 days and is a beta emitter. It will last longer and emit less damaging radiation than iodine 123, so it is preferable for radiation therapy if this isotope is placed in the body. Cancerous cells divide more quickly than normal cells, so radiation destroys cancerous cells at a higher rate than normal cells. Radioisotopes do not need to be in the body to destroy cells. External beam radiation therapy is radiation that is aimed at a tumor. For example, the gamma emitter cobalt-60 is often used for this purpose. On the other hand, brachytherapy is the placement of titanium seeds that contain radioisotopes directly into the tumor to destroy the cancerous cells.